Hey, Dr. Stoker.
Hi, Quinn.
I feel like we need to talk about the facelift recovery day by day. You do so many of these every single day.
Yes.
What's the recovery?
That's a really important topic because it's a process that we go through. As you know, I do this traceless, deep plane face and neck lift technique, and often that involves other things such as eyelid surgery, laser resurfacing, chin augmentation, buccal fat removal. And the recovery is a process for that first week, I would say. We send all of our patients to aftercare because we want professional nursing taking care of them. We love to give them hyperbaric oxygen afterwards. I think it assists in the healing and diminishes some of the swelling.
That's good to know.
Ice on the eyelids is really important for helping to minimize swelling so they don't feel like they were in a boxing match with Rocky Balboa the next day. And then you need to prepare them psychologically to not look good for the first few days because they're going to be raw and swollen and probably a little scared. So we try really hard to educate them in advance, show them pictures, walk them through the steps, keep them in a really positive mental space. And I would say at about day 4 or 5, when the swelling's really coming down, and the laser kind of it's kind of lifting off like a snake shedding almost, and then all of a sudden they can see this kind of a little bit pinkish, like a light sunburn, but no wrinkles.
Yeah.
They kind of freak out over like, wow, this is legit.
They can see the end.
And then we start removing the sutures after that, but usually it's going to be a minimum week off of work, but usually 10 to 14 days for most people if you really go into the office. But if you have a hybrid job where you don't have to go in that often, a lot of people can just miss 1 week and do some Zoom calls, and it's not too bad.
Are they able to drive? Can they go? What do you kind of recommend?
You definitely could, but I don't recommend it for the following reason. This is very delicate skin that we lift and put back, and every time you twist, okay, it's like ripping off a scab on the. We want the skin to stick down, and I want them to look both ways before they cross the road, and I want them to look behind before they back up.
We don't need a bunch of crazy drivers on the streets.
Take an Uber, I would say, and do us all a favor. And yes, you want to kind of minimize the twisting and turning. Keep your chin up in a neutral position. You don't want to give yourself a double chin while you're healing. Just leave it all nice, just like you spread out your comforter after you wake up in the morning. You want to keep that skin nice and smooth in there. Don't twist it and stress it.
Yeah. Is there a day-by-day, like bandage removal, suture removal? What is your...
There is, but we take care of that for the patients because they're at this nursing center, and then when they come and see us, either day 1 or 2, we basically remove all of the dressings then. Sometimes as a reminder, we'll replace a dressing on them if I think they're just like a really animated personality, they're gesturing all over, they can't help but be excited. I kind of want to slow them down by putting a dressing on them to help remind them that they actually did something significant and they need to modify their behavior. And they probably could get away without doing it, but I just don't like problems. I'm busy, they're busy. I want the lowest complication rate we can achieve. And I think if we educate the patients and keep reminding them and they do what we say, we're going to have a very low complication rate.